Do you know what a clinical trial is?
So I asked several people, and the overwhelming answers, most people don't really know what a clinical trial is, and no, they wouldn't do it.
So would you participate in one?
Not right now. Not right now.
I will be nervous.
So let's break it down. In a clinical trial, you volunteer to take new medications or treatments so researchers know if they're safe and effective. It's a form of medical research.
That's very important because clinical research is how we get to the latest and greatest medical developments for different diseases.
Black women make up just 2% of all cancer clinical trial participants. Experts say this lack of participation is one of the reasons why Black women are more likely to die from breast cancer.
And we need more science to understand why this is happening and really what we can do about it.
At the same time,
going to research clinical trial, you have to have a lot of trust that the doctors aren't, quote unquote, experimenting on you. Well, guess what? They actually are.
You know, it has to be a sacrifice. And I don't know if I want to sacrifice my health and my life for, a trial.
There is a long history of mistrust in the Black community of the medical establishment. Much of it is well-founded.
take this statue. It depicts the so-called father of gynecology, J. Marion Sims. In the 1840s, he perfected surgical techniques still used today by operating on enslaved women without anesthesia. His statue stood in Central Park until 2018.
During the turn of the century, there was sterilization without consent.
For 40 years, the U.S. Public Health Service let hundreds of Black men in Alabama go untreated for syphilis under false pretenses. It was so they could understand the progression of the disease. That study ended in 1972. And in the 1950s, Henrietta Lacks went to Johns Hopkins complaining of vaginal bleeding. The institution took her cells without consent, and the medical community continues to use them for research today. Her descendants only reached a settlement over her cells in 2023. These are just a few of the historical atrocities committed against Black people, all in the name of research. Even though we now have federal consent and ethics laws to protect people during research studies, this history does contribute to why some Black people shy away from medical research today. That's according to this survey of roughly 250 Black women. It was conducted by Touch, the Black Breast Cancer Alliance. But it wasn't the only reason Black women said they don't participate.
What we learned is the main reason why Black women don't participate in clinical research is because doctors don't invite us.
Ricky Fairley is a breast cancer survivor, and she also heads the organization that conducted the survey.
Whether it's illicit bias, racism, whatever you want to call it, we're not invited.
I know I wasn't asked. I had to push for it.
Latoya Bowles
So,
Johnson was diagnosed with breast cancer at age 36. She asked her doctor to connect her with the clinical trial.
And he was very dismissive about it, never enrolled me in a clinical trial. So I fired him. Clinical trials do save lives.
Fairley says they saved hers. That's why she runs a campaign called When We Trial to match Black women with clinical trials through online questionnaires.
And we've now signed up, as of this week, 25,241 Black women into clinical trial portals.
She says increased participation is leading to new findings.
And so now there's a growing body of science that's validating that a Black breast cancer cell looks totally different from a white breast cancer cell. And guess what the drugs were made on? The drugs were made on white cells.
So the slide that you're seeing here is
Dr. Dipley
essentially
Sharma and her team at Johns Hopkins invited us to her lab. They're experimenting with treatment options for Black women diagnosed with triple-negative breast cancer. It's one of the most aggressive types, and it's harder to treat.
when they get this triple negative breast cancer, why is it so aggressive? So that was our goal. To understand that. So we use these cancer cells, we use these mice models, and we tried to find out what's different between these breast cancer cells from Black women versus white women.
She says they've been studying breast cancer cells that were donated with consent by Black and white women.
So these cancer cells that are coming from Black women have higher level of these two protein pathways that are teaching a cancer cell how to invade and migrate.
Meaning the tumors from Black women multiply at a faster rate and are more likely to spread to other organs. So far, her team has found that if they use what they call inhibitors and pair it with chemotherapy, it's more effective in eliminating the cancer.
At this point, it's a preclinical finding, so we have to design a clinical trial
to be tested in real people. In part one of this series, we discussed how research like this on Black women is under threat because of the Trump administration's stance on DEI.
Now, we will push back. At the end, we will win. But if you don't do these things with intention, they won't happen.
Dr. Georgia C. Benjamin is head of the American Public Health Association. He says medical research requires cultural sensitivity and relationship building.
In other words, don't go in, don't do research with the community, and then leave and then come back 10 years later to reestablish another relationship.
By email, a Columbia University researcher who's conducted dozens of studies around Black women and breast cancer says the issue isn't getting more Black women to participate in research, it's the medical community's failure to earn their trust in the first place. She adds, quote, "When we build authentic relationships with communities, when our research teams reflect the populations we aim to serve, and when we show up with respect and transparency, Black women show up too." Dr. Benjamin says researchers should also work with trusted Black physicians and pharmacists who can relay clinical trial information to their patients. For Bowles Johnson, participating in a clinical trial was a no-brainer.
I needed my body to be studied. I have 3 daughters who will develop breasts soon. You know, whatever I could do to contribute to Black research on my body to help eradicate breast cancer in any form or fashion, especially triple negative breast cancer, I needed to do it. I had to do this for my children, my girls.
I'm Shanae Williams. For more stories like this, head to wordinblack.com.